Scott, that was awesome. Just you've got to have options. I don't do sick very well. You have a good talk to yourself. Actually, in a couple of weeks' time, I'm going for a hip operation. It's a pretty simple operation, a hip replacement operation in comparison to what Scott's been through.
Hi, Scott, question for you. The last chemo you did, the L, whatever it was, you got very sick. Did you stop your juicing?
Which time are you talking about? You mean when the actual chemotherapy?
No, the last time when you said you got very sick and you stopped it and you said to the doctor, I can't do this.
The IL-21 trial?
Yeah.
No, I didn't stop juicing.
So that wasn't part of your commitment to the trial, that you stop other therapies?
I did stop one therapy, which understandably Grant was concerned because it was a homeopathic and he wasn't sure how that would respond with his drug.
But the juicing was okay?
But yeah, well, I don't know. Eat as many carrots as you want, I say.
You were pretty orange, Scott, I remember.
Absolutely. It's cheaper than fake tan.
How do you know that you still haven't got melanoma? What test did they give you?
Well, I woke up this morning and I'm still alive. It's good enough for me. I don't worry about it.
I'll ask Grant a question. How close are we getting, Grant, to solving the problem? I know we're getting closer and closer, but is it going to be, not tomorrow, is it going to be 6 months' time, another year, or is it another 10 years, 20 years? What do you think is going to be the timeline?
Yeah, so I think we're really poised now to make a real difference with this disease because we're understanding what goes wrong inside the melanoma cell. We're starting to understand how the melanoma interacts with the body, and Scott's story is a great example of that, about how you can focus on doing things to support the body to help with the melanoma, the so-called immune type treatments. And that's all coming together at the same time. So, I think we're likely, by the time, in the next 10 years to actually start to see real improvements in the number of people sadly losing their life to melanoma in our community. But it's not going to happen overnight because it's a complex disease and we've got to bring all these things together and study them properly, particularly, I think, to work out the right treatment for the right patient because, if we really understood the exact fine detail of, why someone like Scott has done so well, then we could roll that out to a lot more people and you would get a lot of people having similar results. And so there still needs to be a lot of research and a lot of effort, but I'm pretty optimistic. And melanoma now is actually the lead cancer for research. I think I don't know if Michael would agree, but Michael talked about this New England Journal of Medicine, which is our top medical journal in the world. There's been 13 articles about melanoma in the last 18 months, just one cancer, because there's just such rapid advances, and so there's such a lot happening now. I'm pretty optimistic that we'll start to get real improvements over the next decade or two, but not necessarily in the months ahead. We'll be chipping away, but looking forward about 10 years from now, I'd be pretty confident we're going to get much better outcomes in terms of less people sadly passing on from this disease.
And if I can ask Michelle, in terms of Scott's experience, from the psychological point of view, have you got comments to make about sort of the practices through which he went from a point of view of a clinical practice point of view?
I think it just demonstrates how important it is to have both, that Scott continued with treatment some of the time anyway, and also pursued other alternative practices that worked really well for him. And I think it just demonstrates that you can have a whole kit bag of things that you're doing to support yourself, and that's pretty much what your story is all about, isn't it?
Absolutely, yeah.
think it reinforces the options that Scott had, and that he had the objective evidence from the researchers to say this, but he also explored other, as I said in the introduction, in terms of the softer research, to go into other areas to assist him. But no less important for him was those other areas to support the other more hard objective evidence that was being provided by Grant and by Michael. Will has a question.
Yeah. On the panel we've got Joe, and Joe is doing on behalf of MPA the prevention and early diagnosis with the hardcore outdoor workers and the people high at risk. She's like the ultimate selling machine of get your skin checked. How would you say that you what advice can you give as a carer, you know, that you were yourself? What would you give advice to other carers about in your life? What would you say, what's the most important thing for you, how you got through, you know, your husband and those kind of things?
Hi, I'm Jo. I was a carer. My husband lost his life to melanoma in 2009 and left me a widow with 4 young boys, then aged 5, 4, 2 and 1. And the saddest part about that was not only losing my sole partner and the father of my husband, or my father of my children, sorry. I really felt that during the journey, and of course it's always about the patient, but I know that there's a lot of carers that are sitting out there in the crowd, and there's a psychological need for them as well, because it's an emotional burden that they're watching their loved one suffer. For me to deal with my husband's loss, it was to keep him alive, so to speak, in the heart, and which is why I started Danger Son Overhead, because it was in his legacy to promote the prevention, awareness and early detection of melanoma to outdoor workers. And it's been 3 years now since his passing, and he's very much alive in my heart and in my children's heart, and there's not too many people who don't know who Rowan Crotty is, which helps me deal with that grief of his loss. So I just think it's really important that if you are a carer there, that there's your own needs that you need to sort of look at too, because unfortunately for me, my husband's journey with melanoma has finished, but he the being of who he was is still alive. So yeah, have I answered?
That's good.
Yeah.
Can I ask one more question, and I'll pass the mic over? I've got a question. As CEO, in the handbooklet, I want to put in there sense of humour as a way of coping, right? Now, I'm not sure if it ever went in there, I probably didn't, but can any of you, the sense of humour, how much that actually contribute to the journey or to, whatever you do, how important is it?
Oh, Scott, we shared a joke or two, didn't we, mate, during the gym?
Absolutely.
Yeah.
I wasn't laughing at the start, but I can laugh now. But yeah, totally. You've got to be lighthearted to a degree. Like, your emotional well-being is very important, and if you're just down in the dumps, like, you're not doing yourself any favours. Like, as much as you might not feel like smiling at the time, like, you've got to try. You've got to have something in your life worth fighting for. You can't just be a miserable grump, and how you feel affects your body in so many ways. It's going to affect your immune system and every other part of your body. And so, I don't know, do what you do. Go to the movies and see a funny movie. Get your funny mates to come around and crack you up. Do whatever you have to do, but feel as well as you can possibly feel.
Yeah. I think it's a distraction too. My husband was, challenging people to go on a marathon, and he had melanoma all up and down the back of his spine. So it made the whole environment around us a lot more lighthearted, because we're also are serious about it, which of course it is. But there has to be those moments that I think has to be good for you, where you can bring a positive aspect. And I think, like you said, Scott, I'm alive today. So let's make it a happy day,
Right, any closing comments from either Grant or Michael?
Oh, look, I just want to thank Melanoma Patients Australia for holding this national symposium. Just absolutely fantastic. We've got the expo to look forward to. And, you know, I feel really enlivened as a sort of researcher and a clinician to be here with all of you. So, you know, just thanks so much on behalf of all the other patients that can't make it today and the great work that Melanoma Patients Australia are doing. I just think it's wonderful. So thank you to Will and the whole team. It's fantastic.
There is one other question, I understand.
Yes, there was. I just want to follow up on the last question, or the one that Will put forward, I think it was. I'm also a melanoma survivor, but I lost my son to melanoma, who had a young family. And humour was terribly, terribly important in that exercise. And you've got to go the journey, and you've got to maintain the lifestyle and be as well as you possibly can do. And I think that is so terribly, terribly important. And the only other comment I'd like to make is one of the most difficult things that I've found in the process of getting the message of melanoma out there is that in my golf club, we have tried to promote, we have one of the great pathologists who works on melanoma, and he's tried to bring forward what melanoma is and how you've got to protect yourself, but nobody's interested until they actually get the disease. And the problem is it's generally, as we hear now, it can be in your body too far. And it's this process of getting people to understand the 1 in 18 average is really quite frightening. You've got to get that message out, and I thank MPA for at least trying to do something.
Absolutely.
Thank you.
Can I just make a comment on that, because you're absolutely right when it comes to the mentality of what society is doing out there. But Danger Zone Overhead is a program that has been designed to give the layman's term about what melanoma is and why we're being exposed or why we're having such high findings. And I find it incredibly honouring but surprised that the information that goes onto these sites is extremely simple, but it's information that they haven't heard before. And that information helps change the mentality that we have in our society of why we are so relaxed about our exposure and everything like that. So I think there is a way that we can change that mentality and in a simple way, in a simple manner. So, yeah.
Good. Thanks, Joe. I'm just going to ask Scott whether or not we can get, like most of the other presenters have provided, we'll have a PowerPoint presentation, which I understand through MPA you're going to get a copy of. Just that I'm wondering whether or not we can get a copy of Scott's.
No charge.
I think it's a very sophisticated presentation, but as I said, in that, it was awesome.